Hi, I'm Erica Pop with the Education and Development Department here at the Visiting Nurse Service of New York. Today we're going to discuss the updated policy and procedure regarding do not resuscitate orders. Some guidelines for home care clinicians. What is a DNR? Do not resuscitate order means do not begin cardiopulmonary resuscitation in the event of cardiac or respiratory arrest. The purpose of a DNR is to honor a patient's choice regarding the administration or withholding of cardiopulmonary resuscitation. VNSNY Home Care is committed to honoring such request and, whenever possible, to assist the patient in having a dignified death consistent with New York state law and the wishes of the patient. A physician's order is needed for a DNR to be valid. In the home setting or non-hospital institutional setting, such as assisted living, and under the New York state law, a DNR order must be documented by a properly executed non-hospital order to do not resuscitate or medical orders for life-sustaining treatment, or MOLST. When does a DNR take effect? A DNR order, whether via a non-hospital DNR or via MOLST, takes effect as soon as the patient's attending physician writes the order. This constitutes a directive to VNSNY staff to not call 911 in the event a patient's heartbeat stops beating or they stop breathing. As per the revised VNSNY policy, a properly executed non-hospital DNR, Emergency Response Medical Services, or EMS personnel, and other first responders must honor a non-hospital DNR order or MOLST if 911 is called. EMS may refuse to honor a non-hospital DNR order or MOLST if there is reasonable evidence that the non-hospital DNR order or MOLST has been revoked, canceled, or a family member requests resuscitative measures and a confrontation appears likely if such request is denied. However, when cardiac or respiratory arrest has not occurred, 911 must be called to address other medical emergencies and provide appropriate treatment, unless the patient or healthcare agent gave contrary written medical instructions. In cases in which the patient may be appropriate for DNR but does not have either non-hospital DNR or MOLST, VNSNY Home Care should educate the physician, patient, healthcare agent, and/or surrogate that may be appropriate concerning the potential benefits in making such an advance directive or DNR order. If the relevant parties are interested, VNSNY Home Care, if possible, will facilitate and offer assistance to the patient, healthcare agent, or surrogate, and the physician in obtaining the necessary consents and completing the necessary forms for the issuance of a non-hospital DNR order or MOLST. What does the clinician need to do? Obtain a copy of the signed non-hospital DNR or MOLST/e-MOLST to be placed in the medical orders section of the patient record. A copy should also be posted in a prominent location in the patient's home for immediate reference by caregivers or by an EMT should 911 be called. Enter DNR orders into the electronic records. Educate patients and their physicians, healthcare agents, and surrogates as appropriate regarding the options available to document a patient's choice regarding CPR. Assist in obtaining the proper documentation to reflect the patient's wishes concerning CPR in the home setting or non-hospital institutional setting. The nurse must educate the home health aide or the non-hospital DNR MOLST procedure and what to do in the event of a cardiac or respiratory arrest. In the event of cardiac or respiratory arrest of a patient who has a non-hospital DNR order or a MOLST, e-MOLST, which contains a DNR order, then, if the home health aide is present, the home health aide alerts the family member and healthcare agent of the patient's changed condition and calls the coordinator of care or visiting nurse ICTM. If a family member, healthcare agent, or surrogate is present in the home health aide supports such family member, healthcare agent, or surrogate in complying with the DNR order to not call 911. If a family member, healthcare agent, or surrogate objects in such a fashion that a physical confrontation seems possible, the home health aide allows 911 to be called. However, upon arrival of the EMT personnel, the home health aide immediately alerts the EMT personnel of the DNR order or most form, which contains a DNR order. If no family member or healthcare agent is present in the home and the home health aide is able to reach either the COC or the ICTM of the team, the home health aide complies with the DNR order by not calling 911. If the home health aide cannot reach the coordinator of care or ICTM, the home health aide calls 911. However, upon arrival of the EMT personnel, the home health aide immediately reports to the EMT personnel of the presence of the EMOST form or non-hospital DNR form to make sure the wishes of the patient are being honored. All VNSNY employees will honor a non-hospital DNR order or EMOST form unless they believe in good faith that consent to the DNR order or MOST has been revoked or that the DNR or MOST form has been canceled. To read the updated policy and procedure for Do Not Resuscitate in its entirety, please refer to the VNSNY intranet section for policies and procedures. It is listed under Do Not Resuscitate. Thank you so much for the work that you do every single day for our patients.